for it, but I noticed that my eyes is a little wonky and my vision gets dark sometimes.
Okay, yeah, you probably need to have that checked out. So, like we said before, we need the biopsies. So we're gonna get the biopsies. What's interesting is that when they went to do the ultrasound biopsy of the liver, they couldn't see it on their machine. So we don't know for sure what that is.
Right now, what causes that? You don't know what causes that? You don't know what causes a scan not to show?
Oh yeah, all the time. You know, you get the contrast in you. The machine takes slices of you. So maybe maybe what was there was an artifact left over from the slice before. It's called volume averaging. Sometimes it has to do when the contrast goes through that little blood vessel at that moment. So there's lots of reasons why that happens. So that was scheduled, and then I don't know who the radiologist told.
Couldn't go any further if they couldn't see anything. There was nothing to needle if they couldn't locate. That's what the doctors explained.
Yeah, exactly. So we still have to figure that out. So right now we're pretty sure it's going to be cancer, but we don't know if it's stage 4 or not. We don't know. So we have to get all these, get the tests done. I'm going to check one thing, please.
And while you're checking that, did I understand you correctly when you said that there is no medication or anything for her burning that she's experiencing?
Yeah. There's something called gabapentin. It takes a while to work. The main side effect is making you sleepy. We could try that, but again, I don't know. The nerves run in certain distribution through your body, and this doesn't seem to follow that distribution. So I'm not 100% sure what it is.
Let me ask this. Have I had any imaging work to this side of my body?
No, and I'm going to order that.
Nah, because we worrying about over here.
Yeah, you haven't had a CAT scan of the chest.
Nobody's doing nothing about this tightening. And I was going with the flow, but now I can't trust to go with the flow.
To stage your cancer, we have to do a CAT scan of the chest. So I was getting there to running through what tests we need to get done.
Okay.
And I thought an MRI caught everything. You know what I'm saying, in the body, you know?
No, the MRI is just where you put it.
Oh.
The MRI doesn't do everything. So,
okay, I understand.
They've scanned you from the lungs below, the bottom of the lungs below, but they have not scanned your chest, and you have to have that. So you're going to get a scan of that. And then, so you're going to get a scan of that, and you're going to get the biopsy.
Okay. And then once you understand what it is, then you can recommend medication for her discomfort.
Oh, well, I guess I'm still talking about the cancer. So we can go back to that in a minute.
Okay.
So then we'll know what stage you are and what to do next for the cancer.
Okay.
So I can give you this gabapentin. I don't know.
I've had it before, so I'd rather not take nothing till we know what I'm taking it for.
Okay, the CAT scan may or may not tell us about the burning pain.
Okay.
It may or may not. If it's just something there pushing on the nerve, it'll tell us, but if there's not anything pushing on the nerve, then we won't have a cause for the burning pain.
Because they do have the IMRT, therapy.
Right, so if it's metastatic, that means it's spread through the bloodstream to go to presumably the liver is where we're thinking. So radiation therapy won't help at all because it doesn't, if it's in the liver, the way it got to the liver is through the bloodstream. So there's other cancer cells in the bloodstream. So just doing radiation therapy to one place won't address the big picture, and that is that there's the blood cells circulating, waiting to go to the liver again, or to the bone, or to the lung.
Okay.
So the radiation therapy doesn't help at all at that point.
Okay.
So we wouldn't wanna do that, we'd wanna go into something that goes through the whole body, so that would be drug therapy,
Mhm.
chemotherapy or drug therapy.
I understand.
Yeah, so if no one can clarify what's in the liver, let's say we still don't know, we do a bunch of tests and we still can't figure out what's going on in the liver, it wouldn't be uncommon to do a couple of rounds of chemotherapy first, retest the liver,
Mm-hmm.
and then, if we still don't know, then maybe consider surgery.
Mm-hmm.
And if it shrinks, then we'll kind of know it was cancer because we gave the chemotherapy. So there's a couple of scenarios that we would recommend.
But first, we need to see what the testing reveals.
Exactly.
Yeah. Okay.
So we can set up another appointment to meet after the test.
Mm-hmm.
So, Lyrica is a cousin of gabapentin. You wanna try that?
I can just go with it. I done been with this 2 years. I can hang a little longer. I'm not worried about that now. We need to get to the problem. I'm good on that.
Do you think, or have you tried something topical on it? Something on this, rubbing something on the skin?
Mm-mm.
So there's a lot of things out there, for nerve pain.
Mm-hmm.
But it's just on the skin.
But
like a
how do we
blocker or
know
something.
that it's nerve pain?
It's burning is the only, I mean, usually burning is nerve pain.
Oh, okay.
But, and that's why I'm saying it's so weird for nerve pain. It doesn't make physiologic sense for nerve pain. But if you wanna try something,
So she should not be having nerve pain.
it just doesn't make anatomic sense, that's all.
Hmm.
You know, if you're having it, you're having it, but I can't make anatomic sense
Okay.
of it.
Yeah,
Now, the
that's
other
how I
thing-
started.
The other thing is that we have, and most of my patients work with these doctors, they're called palliative medicine doctors, and they work on pain and
We see
other
them tomorrow.
Oh, perfect,
Mhm.
okay, well then let's just have you.
Yeah, we set that up.
Okay,
Yeah.
good.
Mm-hmm.
Are you seeing Dr. Harrington or Julie Damco? I don't know, it doesn't matter. That's terrific.
Yeah, I have it written.
Yeah, cause we was wondering how come they just didn't make it. If we had to come back, it was all in one day, but
Yeah.
come back tomorrow.
It's Dr. McLaughlin, yeah, her clinic here is Wednesday. Perfect, okay, then they will address that, so, that's real good.
Mm-hmm.
All right, so it seems like we do have a plan. So how do you feel like knowing that there's a plan coming together?
Well, I mean, I feel pretty good. Like I say, my spirits is up. I really just feel disappointed in the whole situation when we felt we did everything. So a lot of this is a lot of mental anguish. I have high anxiety. So I try to keep myself calm to wait on the medical end. That's my whole thing.
And that's the hard, that's the
Just
hard
keep
part.
that together.
So when you meet with Lisa today,
I don't know, have a meeting with Lisa.
oh, well, I'll come see if she's
Today,
available.
I wanna make sure that she will be available for tomorrow. I don't wanna
Okay.
rush her schedule, she got somebody in, but tomorrow I'll be here in palliative care, and I want a note left for her to be over there in palliative care,
Yeah,
so we
well,
can
I'll see if
handle.
she's available now.
Okay, everything at
But
once.
she can tell you who to talk to about your experience at Metro.
Okay. And you call it what, the Metro?
They've changed the name a couple times.
Okay.
Patient Experience, I think
Okay.
is what it's called, Office of Patient Experience.
I think I've talked to them.
Yeah, 'cause I was trying to get a hold of somebody and it
Okay.
just kept looping me around. So, I mean, we didn't know what to do with it.
Lisa's the best in the world.
I mean, they steady sending, flyers like, how did we do?
Yeah. Well, I hope you told.
Well, yeah,
Well.
I mean, I had to tell them, I couldn't.
Yeah.
But this sounds really good, so.
You have any questions, Joanne?
Let me check another thing. Okay. While you're here, can we get some blood? It's been through since May. We'll test the kidneys, gonna test,
Oh, and I had a blood test, what's up?
You had the CA19-9, the protein that's sometimes elevated in pancreas cancer, but not all cancers make it, and yours didn't make it. So we won't be able to use that as a marker. Sometimes you can say,
What is her number? Can you tell me? Can you tell her to tell me what the number is? Did it give a number?
Yeah, less than 0.8.
Oh, wow.
So assuming it's cancer, assuming it's adenocarcinoma of the pancreas, it's not making that.
Thank you, Lord.
But we'll see. It's not good. or
What
bad, it
could
just
cause a
is.
lesion on the liver, though?
There can be a lot of benign things, there can be a lot of cancer things.
I did read that.
Yes, there's a whole list of things, and what we talked about, the timing of the contrast and when they took the picture, whether it's left over from the slice before, so there's just many different.
Because they say, and I don't understand this, not all lesions are tumors, but all tumors.
So lesion, tumor, nodule, they're all the same thing.
Okay.
Yeah, and so, and people will say those instead of cancer, but they're also benign, so it's very confusing.
Yeah, I did read that and I didn't understand. And I was talking to my nephew yesterday and he was trying to figure it out. I said, I don't know, we gon'
Tell me all the same, and everyone calls it something different.
Yeah.
So I like to say that there's a mass in the pancreas, and we gotta figure out what it is.
Yeah. It's on the tail still. Okay. Yeah, okay, well. Okay.
Okay, let's get the blood, let's get going, Give me
Okay.
something
Let
to
me
eat, and get my medicine.
Let me see if Lisa's here.
Oh, right.
Yeah.
Come on.
Does her eyes look clear to you?
They do.
Okay.
Yeah.
Okay.
They look a little pale, but they look clear.
And then you think she might be anemic because she's pale?
Maybe, maybe not. But we'll know. We'll check blood work.
Because the liver is the one that gives you the iron, right?
No, it's abnormal if the iron's in the liver.
Oh, okay.
So,
Okay.
but sometimes people get something called anemia of chronic disease, where because they have a condition, their bone marrow is just slow to make red cells. It just
Okay.
gets kind of sluggish. So, but we'll test for that in the blood work in addition to the liver, which I think is gonna be fine, and the
Okay.
kidneys.
Well, thank you very much.
You're
You're
welcome.
very helpful, thank
Good,
you.
good.
Yeah.
Very reassuring.
Wait here for me, because I'm gonna check about.
Oh,
this.
yeah, I'm not gonna go with you.
Okay.